and welcome. Today, we will discuss the scanning protocols and how to proceed with the scans, that is, what type of scans are needed in case of different dental situations of a patient. Here we will discuss the three conditions: Dentulous, cases with metal restoration, and Edentulous. At first, we will take a look at Dentulous cases. The basic file is a CBCT.com file of patient. Apart from that, you'll need to have either scans of the stone model or impression or simply an intraoral scan file, else the cast can also be scanned using an extraoral scanner. Now, what if your patient has metal restoration in the teeth being scanned? There's always a probability the scans would be distorted. In case you face the clinical hurdle due to the presence of metal restoration in the CBCT scan of the patient, it is advisable to process the case by following two steps: CBCT of patient with PVS impression, and CBCT scan of PVS impression only.